Good morning, everyone. My name is Dina Desiree Coetzee. I am the owner of Beauty Inc. and Beyond right here in Ponte Vedra Beach, Florida in the USA. I'm about 15 times certified. I do anything from paramedical tattooing, mastectomy survivors, skin rejuvenation, stretch marks, acne marks, and then as well as permanent makeup for cosmetic reasons or paramedical reasons. Today, I have a client who's going to come up for a follow-up. I want today to make sure you know the difference between a follow-up and a touch-up. So when you book your first service with me, it may be on virgin skin or maybe it's old tattooing you want me to fix. I always give you a follow-up. My follow-ups are free. It is your responsibility to make sure you book them and you come. So let me explain to you why you need a follow-up. Number one, all permanent makeup procedures are a 2-session procedure and they should always be 5 to 6 weeks apart. You should not wait longer than 6 weeks to come back, definitely not longer than 8 weeks. If you come to me, I include it in your price. The reason for this is I need to see how your procedure healed, what the color is, and exactly how the pigment reacts in your body. Usually that is also the time at the follow-up when we correct the imperfections. In any tiny little hair stroke or lip line, anything, we can fix it there. Now, why a follow-up? A follow-up is, and why can I not predict exactly how you are going to heal and how it's going to look? Permanent makeup and pigment, the way it reacts in every person's body is as unique as your fingerprints. Your permanent makeup results will depend on, yes, your technician's technique and skill, and whether the person has colored theory, whether the person understands the Fitzpatrick scale of skins, and whether the person know not to put a blue-black color in a person who's already very cool because it will heal blue. It depends on your skincare, on your habits, what you eat. Did you know if you eat very salty foods such as fish or maybe crisp chips and things, the first 3 days after your lip blush, that you can remove your lip blush? Yes, it sounds crazy. This is why you need to do your research and you need to go to someone who is really very, very well trained. Then it depends on your skincare, whether you swim in the sea, do you sweat a lot, do you exercise a lot? All those things will affect your follow-up and your permanent makeup or your paramedical tattooing. So it is very important you come for your 5 to 6 week follow-up. Today I have a follow-up on powder brows. You will hear the lady say she's not even sure why she's here because they're perfect. And they are perfect, except for the trained eye. I could see a few little spots where we could actually touch up a little bit. I hope you enjoyed this video. I hope you enjoy seeing me doing her. She's very happy with her brows and she's coming back for her eyeliner and her lip blush because her daughter is getting married and she knows she's going to be very busy during all the festivities. And that will really give her extra time to spend with the family. Touch-up. What is a touch-up? A touch-up is anything after 8 weeks. If you schedule your follow-up 3 months after your first visit, I'm going to charge you for a touch-up. A touch-up is usually due, depending on the person's skin again and all those anatomy and biology of every individual's person. It will also depend on how oily the skin is, as I said before. So a touch-up is usually 18 months, 3 to 5 years out. I require my clients to schedule a touch-up 2 years out, and you better do that because I will fill up and I will be busy. And then if you do not need it, you can reschedule, or if you need it earlier, you can then call me and I will make sure to fit you in. And the reason I want you on the books is so I'm aware of you and I do not file your medical files I have on you, that I will have it here in my little suite or practice. Otherwise, I put it away in storage. I do have to keep it for at least 6 years. However, I do not have enough space here to keep everyone in this location. So enjoy watching me doing the follow-up today. Hopefully, if you have any, please do. If you find these videos interesting, if you find them informative, please do like and subscribe or follow. And if you have questions or you want training, please do reach out to me. I also train. I do take in people who can shadow me. My prices are very affordable, and it will include your machine as well as your pigments. So enjoy, and here we go. Hand sanitizer, and then only the new gloves. Okay, enjoy watching me work. So I don't have to reshape or remark. I'm experienced. I know I'm gonna go exactly over what she has. However, if you're new and you're unsure, feel welcome to do that. Once again, now it's clean. I'm not gonna do alcohol again because I don't want that to burn and make her bleed. So some people put it on their index finger, some on their middle finger. I like my index finger because we have to do the stretch. You see, and there I already got some ink on my fingers. Oh, I hate that. So now I draw up the ink. You see? Make sure that air pocket stays open. I'm actually going to do it standing today. Usually I would have them lie down. I start at the tail, and I do use this little, so you'll do a 3 stretch. I stretch and like this, and you'll do. So she told me she doesn't want it too dark, so I'm just going in like this. I'm doing the whipping, because if I do this one back and forth, it's going to form a line and make it too dark. We're just touching up. So a follow-up should not take more than 2 hours. She has cream on her skin, so I'm going to wipe that off. She has sunscreen on, which is very good that she did that, but that makes my hand slip. So we're just wiping it off. I'll give her some afterwards. Okay, so today I'm working like this. I'm just lightly whipping. Usually you would work in very small areas, but this is a follow-up. I'm gonna test and see if it's stuck. Now this client she followed the instructions. She didn't drink a lot of water, a lot of coffee or alcohol. She's not bleeding. You see how intense pigmentation is? It's like there's everywhere yellow when we do it. So it looks like it's stuck. So I know this is the correct depth and the correct needle. I wish I had someone who could be here taking the 3-way stretch, people. You are bleeding a little. So she's bleeding a teeny bit, but she's on medications because, you know, people are on medications. That's just how it is. Turn to me. This was a perfect color for her. I'm gonna give her epinephrine because look, she's bleeding. But I first want to try and do, and people please stretch that 3-way stretch. I want to try and do this, finish this. When you come to the front, be careful. Soft. You don't want them to end up with it being too dark in the front. It it will make them look angry. And ask your clients, not everybody wants square or round. Ask them what they like. Dipping it in epinephrine and wiping it off. I think we're ready to move on to the next one. I'm going to have the epinephrine sit a moment. 1, 2, 3. Wipe it off. Beautiful. Now this side. I like this side's color even better. You would work in small areas. I'm not trying to implant too much, so I'm not even working in a small area. I'm like working in a little bigger areas. I'm trying to make them soft because she said soft. Oh, people, and I love clients who know what they want, because if a client doesn't know what they want, it makes it very difficult for me. So I don't know if you noticed, this side seems to oxidize quicker and darker than this side. Do you guys see that? This side seems more, so I'm not sure if that's the lighting or the camera, but it's the same ink, same pressure. So watch out for things like that. It's sometimes the angle you stand. Okay, so I'm gonna go in a little bit more there, this side, a little bit more there. We're dealing with biology, we're dealing with skin, so. And 1 or twice epinephrine is enough, because it will make the skin hard, and then it will, this seems good, this is good. I like to whip at an angle. I know they teach you everything 90 degrees, but sometimes it's nicer if you whip at an angle. Now I'm just going to measure that they're the same width and the tail ends the same places, and then she's ready to go. So I want to warn you, follow-ups are not always this quickly, and they're not always this easy. Sometimes, I mean, I've had people where they didn't take good care, so they just about lost everything. And it also depends if it's an oily skin. She has normal skin, and she's very lucky. I mean, you can see it's pretty, she has that oily T-zone, but the rest is normal. So it's very easy to work on that kind of skin. Soft here, and I'm gonna quickly see that everything is correct.
She was right. I couldn't even feel it, really.
This should not be, this should not be painful. So I don't want to be drawing on her today, so I'll just do that. So to measure the tail, we're gonna do, yes, from there to there. I can maybe do a little bit there. Chin, please. From there to there. So I'm gonna make the tail a teeny bit darker. I don't bring the tail down all the way, and a teeny bit longer, because you're gonna drag their face down. They're gonna look older. If you bring the tail down like the Gatsby ears, it definitely aged people. Don't do that. Just don't. Okay, now we know the tails are exactly correct. Now these are gonna lighten up. They're gonna be beautiful. Okay, the tails are correct. Now I'm just gonna quickly measure the width, make sure that's correct, and then she can be going. When I measure, and usually you would do this beforehand. I mean, I use a caliper that is electronic because I don't want to take any chances. So I have something that gives me the numbers. I've just learned through the years. So you can't touch her. You have to do it like this because her skin is broken. So I just do it like this. I can see that's the same, maybe a millimeter there. It's the same. That's the same. Okay. To where the arch is. We did you good, girlie. Okay, I hope you enjoy it, and remember, you too can wake up with makeup. Before I go, always ask your client if they do want to book another service, because some people are shy or they think you're too busy and they think they have to rush for the next client. You don't have to rush anyone. So you ask your client. I already did mine, and they can say yes or no. Okay, you too. Wake up with makeup. Signing off. Oh my goodness, I can't. Need to show you how silly I look. Signing off, everyone.